Hi, I'm Nicole Wiseman. I'm the unit manager of the Deflection program, and I'm excited to share with you all how the Deflection program has expanded and what you have to learn about it next.
Through every note, every performance, the arts connect us. The arts connect us through joy and through awe, bridging cultures and generations. From intimate theaters to the grandest stages, the arts bring us together, reminding us that we're never truly alone. When we experience the arts, we experience each other. Kentucky Performing Arts. The arts connect us.
Hey y'all, I'm former State Representative Attica Scott, and I'm here with Stay Live Streams. Thank you for joining us today. As always, we appreciate the Goodwill Opportunity Center for opening its doors to us for this conversation. This is what community looks like. This is what a community resource looks like. It opens its doors for us to use what's available to us. I am joined today by Nicole Wiseman, who is the unit manager for the Deflection team at Seven County Services. And for full transparency, I was the Louisville Metro Council representative on the board of Seven County Services years ago. But I just want to put that out there for anybody who at some point says, well, wait a minute, she's being way too nice. Is that because she served on the board? But I served on the board because I believe in the mission of Seven County Services. So, Nicole, thank you for joining us. We're going to have a conversation. It's going to be chill, relaxed. Folks are tuning in. They may have some questions from the audience. If so, we'll look to Maxwell for those questions, maybe midway through. But otherwise, we have some questions for you to get the conversation started because we know folks want to know about the deflection program. All right, fantastic. So, my first question for you is what is the crisis call diversion program, which is also referred to as the deflection program. Is that correct? Okay, all right, folks. So I was a little confused at first. So the crisis call diversion program is the deflection program. So you probably heard both, and you were like, are they different? Are they separate? But it's the same at Seven County Services. So can you tell us what this program is?
Sure, yes, and that's basically just this kind of shorthand version
Okay.
of it. So basically, we have a team of folks that responds to folks that are calling into 911 and experiencing a mental health emergency.
Okay.
So that could be really a variety of different things. They could be experiencing thoughts of suicide. They could be at a place where they're interested in getting into some recovery services. Really, anything that they determine is a crisis.
Okay.
We kind of let that be up to them rather than us.
Now, does it have to only be the person experiencing the crisis, or could I call in to say, my uncle's having a crisis? Could I do
So
that?
the way that we like to call it is that you call deflection with somebody, not
Okay.
on somebody.
Okay.
So say we're here together and I'm having a crisis, you can absolutely give a call to 911 and request support from me.
Okay.
Because you're here with me, you know what's going on,
Mhm.
you know a lot more about the situation. However, if you are, for instance, out of state or you're not physically with that person and you're concerned about them, and rightfully so, it sounds like, what you might want to do in that case is call 988 on their behalf, for
Okay.
instance. That may be a better response for them.
Okay.
Because right at this point, we can't physically respond if we don't have a good idea of really what's going on with that individual. And we would not want to respond and it be something where, for instance, they're having a medical emergency, and we're not equipped to handle that as quickly. So
That's right. So would I be calling 911 or am I calling seven counties?
So whenever you are reaching our team, you are contacting 911.
Okay.
However, we are a part of seven counties. 988 is also a part of seven counties. They are separate programs, though.
Okay.
So one of the things that we really like to do is have folks focus on 988 as being the first response for people dealing with a mental health crisis. And they can certainly get to us or to one of the other mobile teams that's through 988.
Okay.
But that's probably going to be your best bet to get a mental health professional in front of you as quickly as possible.
Okay. So most people will know to call 911 in all honesty, right? Because
Correct.
a lot of folks still don't even know what 988
Correct.
is. So if I call 911, what happens? How do they know to reach out to you?
Sure. And that's one of the barriers that we have, and that was one of the big reasons of wanting to get 988 going. So just as quickly as you think 911, if you're having, something where you have police, fire, EMS kind of emergency, if you're having a mental health emergency, we want to think 988. But of course, it's probably some years out. But if you've called 911, you can request the deflection program.
Okay.
You can let them know that you or somebody you're with is having a mental health crisis, and they can get them over to our crisis triage workers.
Okay.
Those folks are Seven County staff that are actually in the 911 call center. They function a lot like the crisis line in that they talk with folks over the phone, they de-escalate, they provide resources, really meeting them where they are.
Okay.
One of those resources that they can offer is the mobile crisis response team, and they go out and meet that person wherever they are in the community.
Okay.
Really further that de-escalation that was happening over the phone. Continue to offer resources. They can also transport folks to anywhere within the county. One of the big perks of this program is that we are able to offer a lot of different options for folks.
Okay.
A lot of times, folks that are in mental health crisis say, I need to call 911, I need to go to the hospital. That's the immediate thought. When we know that there are so many other options for folks that are going to be a much better fit.
Okay.
We say, here there's some, intensive outpatient options. Let's get you a crisis assessment a little bit more quickly than you might already. What are some recovery options? What are community resources that exist? What can we do to wrap around supports
Yes.
to help you stay healthy and in the community as much as possible?
Absolutely. Okay. So what led you to get involved with the Deflection program?
Sure. I feel like a lot of different things.
Okay.
My background is with our crisis line, so I already was very familiar with the population. Also know how important it is to be with somebody who understands what you're going through. I have some past work in peer support as well,
Okay.
managing volunteers that connected with other folks diagnosed with cancer. So just having somebody that understands is huge. And knowing that somebody, whenever you're in a mental health crisis, you want somebody that's a mental health professional. And that's not something that's for police, fire, and EMS. They have their own things that they are more suited toward.
That's right.
We want to have the best resource in front of somebody. So just knowing all of those things and knowing that this was an option, I said, yes, please.
Okay.
I would love to be a part of it. So I've been very excited to be a part of it and see how it's grown over the past couple of years. More than a couple of years now,
Yeah.
almost 4 years at this point.
Well, let's talk about that. So the program started in March 2022. Is that correct? So can you talk about how it's grown since then?
Sure. So it has grown exponentially. We started with one police division, the fourth division, as they had the highest number of essentially mental health calls.
Okay. And I'm going to stop you right there. Where's the 4th division?
So it is kind of a little bit past Broadway, Old Louisville, down to U of L, kind of that central area of town.
Okay.
So yeah, that's where we started. We also there's lots of research that went into the actual program getting started.
Okay.
What other programs were taking place across the country, what that would look like here, knowing the population here, the resources that we have available. Really got together with a lot of folks to determine what would be the best fit for Louisville. So we had folks from academia, we had folks from mental health facilities, first responders, folks that have experienced mental health crisis themselves. That lived experience is very, very important to us.
Yes.
Community groups in general, just all of those folks coming together to figure out, okay, what should we do here in Louisville? So that's kind of how we started. Looked at the data and saw that that was where the highest number of calls were coming in, and also 2 p.m. to 10 p.m. Was the time frame where those came through the most.
When you started?
When we started. And then just as soon as we had enough staff, we continually expanded. So we expanded divisions and also expanded hours. So as of last July, we were 24/7.
Okay.
And then in February of this year, we just only a couple months ago, we're available in the entire county. So it was first LMPD divisions, but now it is everywhere within Jefferson County. So any of those that have their own police departments, we were working with them as well because they have a slightly different process than LMPD does. So we were making sure that we were well prepared and well suited each time we expanded.
Okay. So I'm thinking about Goodwill as a resource. So how would you get the word out to folks here at Goodwill that the crisis diversion program exists?
Yeah, that's a great question. Honestly, a lot of it is sharing the word about 988. Because we know that folks are still going to call 911. And if they do land there, we want it to be a good experience for them and make sure they get the support that they need. But really pushing 988 as much as possible and letting folks know that that's where they want to call when they're in need of support is the biggest thing, probably. So some word of mouth, some meeting with folks, some, publications and whatnot.
Yes.
A little bit of everything.
Yes. Well, I would say this is an amazing place and space. Like every time I come here, it's packed. There are lots of people. So we need some information on the tables for folks for sure. Okay, fantastic. So can you talk some about the administrative structure of the program, and in particular, like how does it work from an office perspective, right? So folks who are tuning in are like, well, okay, So I know what to do if I call, but like, what does it look like at 7 counties?
Sure. So as mentioned earlier, I'm the unit manager,
Okay.
and then I have 5 team leads. So that means that there's always someone that is on 24/7. They are kind of the operations person, if you will.
Okay.
So we have the call comes into 911,
Mhm.
and then it gets transferred over to our crisis triage workers.
Okay.
Those folks are there in the 911 call center.
Okay.
And we have our mobile crisis response team, and they hub out of a 7 counties office downtown. So they're pretty easy to get to most everywhere in the county. We also have a couple case managers that follow up with folks after the crisis to make sure they got what they needed.
Oh, good.
So there are all those folks that are part of it. And then I report to our VP of Adult Services through 7 counties.
Okay.
So that's kind of what it looks like administratively.
All right.
In terms of when the call comes through, say for instance, they are connected to our CTW. They talk for a little bit, and they determine together with that individual that it would be great if our team could come out. One of those CTWs is going to give a call to one of the staffers, one of those leads, and say, "Hey, this is what's going on. Does this feel like this would be a good fit?" Basically, because that's a best practice in crisis. We don't want any decisions in crisis to happen in a vacuum.
Yes.
We want to bounce that off another person. So it's very collaborative. So they might have some new things to offer to them, or they say, "Okay, great, let's do that." Then that team goes and responds in person. And ideally, as much as possible, the CTW's on the phone with that individual until the team arrives.
Crisis triage worker.
Right.
Okay.
Yes. Thank you for, I know, all the acronyms too. Until the team arrives.
Okay.
They continue that de-escalation, and then they hand off into the next resource, whatever that looks like. And then our case managers follow up after the fact.
All right.
Got a few extra things in there when you ask me a question.
Yeah. Well, no, I'm glad that you did. So maybe you can answer this question, maybe not, but I'm going to ask it anyway because it just made me think about it with the administrative structure. So how's the program funded?
Sure. So 7 counties is subcontracted through Metro Emergency Services.
Okay.
We're the ones that provide the service, and they are the ones that oversee that piece. So I'm with 7 counties. It's just one of the many contracts that exist.
Okay. All right. I think we may, after this question, need to take a break. I'll
Sure.
check in with Maxwell to see. But for folks who are afraid of police showing up at their door, can we talk about some of the key factors that can lead to a mental health specialist responding to a call rather than a police officer? So I know when I was doing my research, some of those examples of what you all might be looking for include someone harming themselves, or actively threatening with the weapon, or some other form of violence taking place on site. So can you talk more about that?
Sure. So those are, of course, our exclusionary criteria right now. And as we've talked about before, 988, of course, is going to be the best option for folks because whenever you call 988, I believe the current stat is less than 1% of those actually result in a police response. So less than 1%.
Okay.
So that's a big piece of it.
Yes.
As for those, we are trying to get to those situations as much as possible, as quickly as possible. And that may be when police have gone out first and then they call us in after.
Okay.
So if somebody's already harmed themselves, obviously we want them to get medical attention as quickly as possible. So that's going to be the focus. If they are actively threatening with a weapon, that's still going to be something for them, at least initially.
Okay.
That the safety piece is very important for us. We want to make sure that it's safe for our responders as well as for the folks we're responding to. So that's a big piece of that. People say, okay, what about having a weapon? Period.
Yes.
Maybe I'm a gun owner. Is that going to disqualify me? No, absolutely not.
Okay.
Are we responding to someone that's on the street and they often have something on them for protection? Is that going to disqualify them? No, as long as it's not part of what's actively happening. If they're saying they're active, I have this in my hand, and I want to, I want to take my life right now, then that's still going to be something for them at this point. But again, we try to get there as quickly as possible after that and collaborate as much as possible.
Okay. Thank you for that breakdown.
Sure.
So I'm going to check in with Maxwell. Folks who are tuning in, if you have any questions, please put them in the comments, and we'll try to get to your questions after this break. Thank you so much.
Through every note, every performance, the arts connect us. The arts connect us through joy and through awe, bridging cultures and generations. From intimate theaters to the grandest stages, the arts bring us together, reminding us that we're never truly alone. When we experience the arts, we experience each other. Kentucky Performing Arts. The arts connect us.
Hey guys, before we get back to the live stream, I'm Tracy, the bartender at Southern Hospitality Bar and Grill, located at 3402 West Broadway. You guys got to come and check us out. You can call your order in, and the phone number is 502-822-1474. Again, I'm Tracy, the bartender at Southern Hospitality. Come check us out, guys.
Hey, I know you're watching the live stream right now, but I want to take a moment to tell you to check out this new book right here over my shoulder. Believe me, it'll be worth it.
All right, welcome back, folks. Again, we're here with Nicole Wiseman, who is the unit manager for the Deflection team at Seven County Services. So, Nicole, we're coming back from questions related to the program, its history, its funding. So, we want to dig even deeper into the program. So, the program has expanded to the entire city, as you said, or the entire county, and including expanding its hours. So, what led to the expansion, and what's next for the program?
Sure. Truly, we wanted to make sure that this was available to everybody in the county.
Okay.
So just as soon as we had enough staffing for that,
Mhm.
and also that we truly understood the different process for each different county or department and those kinds of things, and to make sure that we knew what we were coming into and making sure that we were providing safety for folks,
Mhm.
we were able to expand. So
Okay.
that's kind of where we are now. I think maybe in the future we're looking to respond to more folks that are calling into 911 that are experiencing an emergency
Okay.
and more of a behavioral health nature. So the ones that we're not able to respond to right now or might want to respond to more quickly, they're actively threatening with a weapon. There's already been some harm that has taken place, making sure that we're getting to those as quickly as possible. I feel like it's probably one of our next expansions.
Okay.
Generally, we're responding to folks that are 16 and up. So we're looking to figure out what that might look like as well to make sure that our kiddos are also getting the support that they need.
Yes.
Kind of what it looks like now is that if they're there with a parent or guardian, then we're kind of identify them as the person in crisis and provide support to them, and as a result to the kiddo. But that's a little bit trickier, so we're making sure that we're well supporting those kids too.
Okay. So you made me think of something. Do you have any kind of partnership or relationship with JCPS?
So we have worked with JCPS, and then they also work a lot with other programs within Seven Counties.
Okay.
So Seven Counties offers tons and tons of resources and different programs. So we work with folks at Acute, with the Crisis Stabilization Unit. So a lot of different resources that are offered there.
Okay.
Yeah.
So it's been 3 years now that the
It
program's
has.
been going. How do you evaluate the program?
Ooh, that's a lot of different ways.
Okay.
We did have an official evaluation a couple of years back, and that was really showing that we were saving police time and directing those resources towards a more appropriate response. So that has definitely grown,
Okay.
as well as us just being available to folks. Whenever you call 911, you have the option to speak to a mental health professional rather than immediately getting a police response. So that's pretty huge.
Okay.
We have a lot of folks that contact 911 multiple times a day. Some people might not know that. So we have those folks that we've been able to work with and hopefully, with most, reduce the number of calls that they are making to 911. So either they're coming to us or they're more redirected to 988.
Okay.
Whatever that option happens to be. And probably one of our biggest success stories is anecdotal things that folks share with us. They share with us that that they called us because somebody else they knew had reached out and we provided support.
Okay.
Or probably one of the biggest ones was we've had folks that have said, I intended to die by police today, and you all showed up instead. So that lands. So that's the kind of thing that keeps me going.
Yeah,
Because
absolutely.
this didn't exist before, and that's an option for folks.
Yeah, absolutely. I hope y'all are taking note of the stories because these are so important to know. So you talked about the success stories, or it's best you can define success, right, in this kind of situation. So can you talk about what it looks like when your folks respond to
Sure.
a call?
Yeah, absolutely. So as we talked little bit about the process, of course, they're talking to the 911 call takers first,
Okay.
and transferred over to our CTWs. Um,
Crisis.
crisis triage workers.
Okay.
I'm gonna get there. Thank you for getting me again. And then our mobile crisis response team that's coming out. So they are coming out in a marked Chrysler Pacifica minivan,
Okay.
a soccer parent van, if you will, unmarked other than the amber flashing lights that we sometimes use for parking if we're in a place where we need to use those. And also our team is responding in plain clothes.
Okay.
So, t-shirts, jeans, and their Seven Counties badge. That's what they are responding physically as. And we thought that was very important because folks that are experiencing a mental health crisis, they have often been met with police and fire and EMS and all kinds of flashing lights and sirens and everything. That's the last thing that you need whenever you're in crisis.
Yes.
So having the folks that are calling in know, okay, this is who's going to be responding, so they know. But everybody on the block doesn't know that they're having a crisis. Was really important to us.
Yes.
And it makes it it's just naturally de-escalating. Whenever you show up in any kind of uniform, there's already a power differential. But whenever you show up in jeans and a t-shirt and say, "Hey, I've been there.
Yeah.
I get it. This is awful. I'll sit here with you through this, and we'll get you to what you need."
Yeah.
That makes such a difference.
That's right. It does. So, do your folks ever respond or get calls for or from people who are in houseless situations?
Yes.
Okay. And what does that look like?
Same kind of thing.
Okay.
However, they make it their way to us, and then we
Yes.
will respond to them in person. It's the same kind of thing. I mean, folks of no matter what they're going through, or whatever they are in their walk of life, that they could still be experiencing a mental health crisis. So we'll just have them show up wherever they are. Sometimes they have phones, sometimes they don't. So it might be they've gone into a business and or somebody's called on their behalf.
Yes.
And as long as we can get enough information to determine it's going to be a safe and appropriate situation for our team to respond, we'll do that.
Okay.
So we'll come and sit with them and figure out what it is that they're looking for. Also in our van, sometimes we've got snacks or hygiene items, things like that, if that's helpful for folks. Tons and tons of resources. So we try to come as well prepared as we can whenever we're responding to folks.
Okay. So, two questions from that. One is, what do your partnerships look like with houseless service providers? And when you talk about resources, you gave one example early on, but can you give other examples of what you mean by resources?
Sure.
So, houseless services and resources.
Yeah. Okay. Let me see if I can stay on track for both of those things. We have a ton of partners and resources and things of that nature. We'd always love to have more because it is very important to us, as I spoke about earlier, that we want to make sure that individual stays in their community and is well supported within their community. So knowing more about resources that exist, whether that's other mental health providers, other community resources that provide food and shelter, clothing, any of those things. Into support groups, we want to be well aware of those so that we can share those with folks. Seven Counties does have their own homeless outreach team, so they're out in the community pretty much daily.
Okay.
So we work with them as well. So, for instance, if we respond to someone that is houseless, we say, "Hey, this is who we responded to. Want to make sure that they're on your list for follow up as well." So that's one of the ways.
Okay.
Seven Counties is one of the members of the Coalition for the Homeless, one of those partner agencies. So really just any and every kind of possible resources that we can help connect folks to, because we don't want to necessarily have them be going to the hospital every time. We want to say, "Hey, here's some other options for you for support." Whether that's mental health treatment specifically or more just social support. So knowing that exists is helpful.
Okay, good. I have one more question, but before I get to that question, I'd like us to take a break if we can, Maxwell, because this next question, folks, I really want you to tune into because it's about how our community can support the Deflection program. So let's take a break and come back and have Nicole respond to that question.
The lights of Kentucky Performing Arts shine on more than our shows. They illuminate a pathway of discovery for all throughout our Commonwealth. A pathway of creativity, confidence, possibility, of brilliance, inspiration, curiosity, and wonder. For 40 years, Kentucky Performing Arts has led a pathway to unite the Commonwealth around the joy of discovering the arts, and will continue to shine this light far into the future.
Are you ready to transform your organization? Chenault Solutions provides capacity building services for leaders and teams ranging from strategic planning, program evaluation, and organization management training. For more information, please visit http://chenault.solutions. Chenault Solutions.
Welcome to Skills for Life, located at 204 East Jacob Street.
She's holding on.
Here at Skills for Life, we offer services 6 months to 12-year-olds.
Tell me what this is. This is the what? The front of the book?
With a warming environment, a comforting atmosphere, with therapy services, social emotional learning, plant-based meals, and more.
Parents can look forward to having their children in a safe environment.
Join us at Skills for Life.
So you cannot check. We have a plant-based diet that we serve, meals that we serve to our children, and they can expect that their children are safe and loved.
And for more information, call us at 502-822-3975.
All right, welcome back, folks, to our conversation with Nicole Wiseman, who is the unit manager for the Deflection team at 7 County Services. So this last question, Nicole, really, it's for you, but it's also for folks who are tuning in. Can you talk about what needs to happen in our community in order to keep the diversion program going?
Absolutely. We talked about how this is kind of a tough one,
Yes.
but probably the biggest thing is letting folks know that 988 exists, and that is really the best place to start whenever you're experiencing a mental health emergency.
Okay.
Because they have folks that are trained crisis counselors that are going to be there 24/7, 365, just as we are, that can provide support to them and get them connected to a mobile team if that's something that they do indeed need. Another big thing, if folks don't have the availability to call 988, for instance, we have folks that have 911 only phones. We're, of course, still going to respond to you all. Whenever you do call in, make sure that you're calling with that person that is in crisis and providing as much accurate information as possible. Sometimes people have a tendency to maybe amp up the response whenever they're in crisis to see if maybe they'll get a quicker response, which sometimes can push that into more of a police response. So we want to make sure it's as accurate as possible.
Okay.
Be impatient when you call because there will be some questions. And we do that just so that we, and you may have to answer a couple times because, of course, you're talking to the Metro Safe call takers and then to our crisis triage workers. But just be impatient with those questions because we do want to get folks the help that they need as quickly as possible and make sure that it's as safe as possible for everybody. So that's probably a big piece too. So 988 whenever possible. And if you are calling into 911, being with that person in crisis and providing accurate information about what is going on.
Okay.
And how we can help.
That's helpful. And I want to dig a little bit deeper because, I'm an advocate and I believe in community calls to action. So what can folks who are watching do to support the program?
Sure. A lot of it is really word of mouth.
Okay.
Sharing with folks that 988 exists. But if there are other ways to advocate for it, that's often helpful as well. So if that's whatever that looks like in their particular community, we're of course supportive of that as well, just to continue having an option for whenever folks call 911 that they do have an option for a mental health response.
Okay. Y'all, Nicole probably can't say it, so I'm going to say it. Make sure that you're reaching out to Mayor Greenberg and your Metro Council member to make sure that the diversion program is fully funded. You know that the budget cycle is coming up for the 2025 to 2026 fiscal year. Nicole didn't say it, Attica Scott said it. So there you go. Thank you so much, Nicole, for joining us and educating folks a little bit more about the Deflection program who may have been wondering, what is this program I keep hearing about? So we appreciate you so much. Thank you to everyone who has tuned in to this episode of Stay Live Streams. And as always, whatever you do, stay healthy, stay safe, and stay live.
It is our duty to fight for our freedom.
We will not make excuses. We will make changes.
It is our duty.
It is our duty to. We must love and support. We must love.
The mayor still plan to spend this money in the same way following this announcement? And if so, why does he think he has the authority?
We have nothing.
to lose.
I've been here every day. We have nothing to lose but our chance. But our chance.